that we want to have butts in the seats for you in your practice, whether it be on the doctor's side or whether it's on the hygiene side. And we want to reduce the number of cancellation no-shows because it simply puts your practice in a stronger financial position. Cancellation no-shows are an epidemic in practices all over today. So if you're experiencing that, you've got a lot of company. It's quite literally an epidemic. And I want to help you change that because it's very, very frustrating when we get cancellation no-shows. And it hurts the practice in many, many different ways. So I want to share with you something that we teach in our coaching that is something that you can apply. And how this relates to the topic of our podcast, Less Insurance Dependence, is that we want to have butts in the seats for you in your practice, whether it be on the doctor's side or whether it's on the hygiene side. And we want to reduce the number of cancellation no-shows because it simply puts your practice in a stronger financial position. You're able to help more patients. You can't help the patient if they don't show up for their appointments. So this is one of those very crucial problems to solve. And the great news is I'm going to share with you something that we have seen time and time again completely change that occurrence in your practice from cancellation no-shows. All right, so I need to present one more kind of overview and then we'll dive into the strategy. So one more overview comes from Dr. Phil, the famous television personality psychologist, on TV. And Dr. Phil has famously said, you train people how to treat you. And I believe that to be true. Naren, would you accept that statement? I believe that to be true. How about you?
Yes, I do.
Yeah, you train people how to treat you. And if you look at a very core level, there's many reasons why people might cancel a no-show. And some of it could be, mundane circumstances. The car battery was dead. The babysitter didn't show up. They got called into an emergency meeting at work. Okay, and any number of other reasons. But at a very core level, the reason why people don't show up is because they can. What are the consequences of not showing up? I mean, there could be consequences. Some practices have a no-show fee or a cancellation fee. Many of those practices will waive those. It's kind of like a consequence that doesn't really have much punch, right? So I want to talk about the opposite. Instead of punishing them for not showing up, I want to train them to show up. I want to train them to be there. So I want you to think about how you could do this. And we teach a new patient experience. I'll share the way we teach this with our clients, and you can adapt this to your office. And so we teach a new patient experience that really, it becomes an experience. It's more than an appointment. It's more than an exam. It's an experience that sort of locks them into never wanting to go anywhere else for their dental care. They become patients for life. And early in that appointment, we go through an interview process. A new patient coordinator does a 7-question interview. And the purpose of that interview is to learn the patient's dental history. Very quick, doesn't take very long, but we learn their dental history. And then it's a way for us to connect with our patients and understand their past history with dental care and their oral health. At the end of that interview, we're in the consult room. The new patient coordinator will turn to the patient and say, Susan, I sure appreciate seeing you as a new patient today in our practice. We love seeing new patients, and you've made a great decision to come here for your care. We're going to work really hard to take awesome care of you. Susan, may I take a minute and share with you what you can expect as an active patient in our practice? And if you nod your head, this is neurolinguistic programming. If you nod your head, Susan, can I take a minute and explain what you can expect? What is the patient going to do in response as you're nodding your head and you're asking that question?
They're going to say, absolutely.
They're going to nod their head right along with you and say, sure.
Yeah.
Susan, there's 4 things you can expect from us. Number 1, we're going to treat you like we would a family member or a loved one. And I know it sounds kind of corny, but we think of our patients as our patient family. We're going to take care of you like you're a family member. Number 2, because of that, we're going to use the latest advances, the best materials, the highest quality process. We're going to, because that's what we would expect if we were a patient. Number 3, we stand behind our work. Susan, if anything isn't right, we redo it until it meets our standard. And number 4, and we would hand the patient a little business card at this point. Susan, this is the protocol to reach our doctors after hours if you ever have any kind of dental concern requiring where you desire to reach the doctor. Here's the protocol on this card. I'd encourage you to keep that in your purse or wallet. Now, if it's routine, you can call the office and leave a message. But if you really feel like you'd like to talk to the doctor as an active patient in our practice, you absolutely have the right to do that. And here's how to do that. Susan, now that I've shared with you what to expect from us, may I take a minute and share what we expect from you? And I'm going to nod my head again. And what is the patient going to do? Sure.
Sure.
Yeah, you bet. Susan, it's just one thing. We expect that if you make an appointment, you actually show up. Now. We know that sometimes things happen. In fact, I saw a bumper sticker on the car the other day that says things happen. Well, Susan, it didn't say things, but I think you get the idea. They usually laugh and say, yes, I saw that bumper sticker too. Well, we get it. We understand things happen. And if they do, and when they do, all we ask is you kindly give us at least 48 hours if you need to reschedule an appointment. That gives us the time to schedule another deserving patient in that time spot. Susan, does that sound fair to you? And what is everyone going to say?
Absolutely.
Let's talk about the psychology behind this. I've given the patient 4 reasons, 4 what for most people are very meaningful reasons to come here for their care. Given her 4, and I've only asked for 1 in exchange. That's a pretty fair trade, isn't it?
Yes.
4 to 1? 4 to 1?
Absolutely got it.
And so really what I'm doing is I'm training her to give us 48 hours. That's what I'm really doing.